Tonight, State Assemblyman Mayes says it is possible there could soon be even more restrictions, and so now he is looking at ways to help small businesses survive. I spoke with him earlier. Chad, thanks for joining us.
Yeah, Peter, thanks so much for having me.
Let me start by asking you, what are your thoughts on how this pandemic is being handled by the state?
Well, I've got lots of thoughts, just like everyone. At some level, I think we're all a bit frustrated, but at the same time, we're going to have to get through this together. I will say, I believe that the governor early on, I think, came out very early and said, "Look, this is a real crisis before us." He acted very quickly in the first stay-at-home orders. I praised him for that. We're now several months into that, actually probably 4 or 5 months into that. We've seen, some hills and valleys. It's very easy to be critical, but I'm also somebody that wants to be as constructive as we can. So we've had some challenges, but we're getting through it.
Do you think we can expect even more restrictions?
I think that's definitely open. I would have said just 4 weeks ago, 5 weeks ago, that I didn't think that the state public health, along with the governor, the administration, was going to shut down. And here we are a couple of days ago. You can't go to restaurants indoors any longer. We've got gyms that are shut down again. And so I think it all depends upon what the virus is doing. I think if the numbers continue to go up, the governor's been very clear that we'll dial the dimmer back down again. Dimmer up, dimmer down. So I don't want to say no, because I would have said just a few weeks ago that wasn't going to happen, and he made that decision, and we have had to do that.
Last night on this program, I had Joseph Miller, who is the owner of Stacy's Bar in Palm Springs, and he says he's on the verge of losing his business. I asked him, what message do you have for lawmakers? And here's what he had to say.
Those small businesses who are able to manage and do the right thing, follow the guidelines, take care of their customers properly, give us the opportunity to do that. The virus isn't going away. Keeping us all closed means the revenue for the state is gone. And the suicide rate's going up, the mental health. I've had 3 friends that have killed themselves in other states because they wanted to make sure their families were taken care of. How do you justify that? How do you have to tell that 16-year-old daughter that her dad killed himself so that her and her mom could be okay? That's unacceptable. There has to be other ways to do this.
Your response to that?
No, I completely feel for him. I've been talking to constituents all over the district, small business owners who are struggling. We have an incredible unemployment problem. Our phones are ringing off the hook on how folks can be able to get unemployment. When we talk about public policy, I'll tell you one of the frustrations that I did have is here we opened restaurants up, and then just before July 4th weekend, we had restaurants that went out and ordered food for a heavy weekend, and a couple days before, we had to shut down the dining rooms, and I know that was very frustrating. We talk about, hey, you can just go eat outside. Well, it's 118 just a few days ago here in the desert, and there's not a lot of folks that want to eat outside in 118 degrees, and so the impact that's having on small businesses is incredible. And so we have to be thinking about that. And as policymakers, as a lawmaker, we've got to be thinking about those small businesses, how we can make sure that when we get through this pandemic, that they can continue to survive.
Should coronavirus relief be determined based on need in the state of California? For example, you mentioned that it's over 100 degrees outside here in the Coachella Valley, and this is a region that depends heavily on tourism.
Yes, which is why I've been arguing all along that a top-down approach doesn't necessarily work in California. I'm a believer in sort of bottom-up and local governance, allowing cities and counties to be able to make decisions. I think Riverside County has done a good job. I think San Bernardino County in my district has done a good job. Have they made some mistakes? Yes, sure they have. But I think it's better to have decisions made at the local level. Why? Because it's 118 degrees here in the Coachella Valley, and it might be 68 degrees or 67 degrees in Monterey. And so when you think about that, having a top-down approach, you're not allowing locals and those different geographic diversity that we've got, you're not allowing locals to be able to make those decisions. And I think that's been a bit of a shame.
I always encourage our viewers to send in questions ahead of time for our interviews. I had posted on social media we were going to be speaking with you today.
No.
And here's what one viewer sent us.
Hi, my name is Jimmy Lecklider, and I am a resident of Cathedral City. My question for Assemblymember Chad Mayes is, what is your office doing to help the citizens of the Coachella Valley during this COVID crisis? I also would like to know, how can your office help nurses in the Coachella Valley provide safe patient care when the local hospitals have applied for a ratio exemption, putting patient safety at risk? Thank you.
Your response to him.
Well, Jim, it is great for you to reach out and to post that question. In regards to what our office has been doing, I think we've been working, I shouldn't say think, we have been working overtime in responding to unemployment claims. In fact, our phone has been ringing off the hook, and we're putting almost all of our effort on making sure that constituents here in the 42nd Assembly District are able to get in touch with EDD to be able to make sure that they can begin to receive unemployment so that they get a little bit of help that they deserve. In regards to hospitals and nurses and those ratios, I know that there has been a handful of waivers that hospitals have gotten. And because I'm not in hospital administration and I don't know exactly those dynamics that are there, it is incredibly important that we make sure that our providers, our doctors and our nurses don't get overworked and aren't exhausted, and there's enough of them to be able to provide for the patients that show up at the hospital. So I'm also very supportive of that. Before
we let you go, is there anything else, sir, you would like to say?
No, Peter, is just really good. The one thing I do want to say actually is our office is here to help. I know that through these times, things are incredibly frustrating, but I would love if we can help you in any way is to reach out to our office at 760-346-6342.
All right, Assemblymember Chad Mayes, we appreciate your time.
Thanks so much, Peter. Thanks for having me.